As the senior population continues to grow, so does the need for assistance. The services of a home health agency may be the solution. However, before making a decision, there are things you should know and questions that you need to ask. Here to share some tips and important questions to ask when selecting a home health agency is Lou Donaldson with TLC Caregivers. Thank you for being here.
Thank you for having me.
Well, first of all, let me acknowledge TLC Caregivers and the Council on Aging have had a long relationship, and we have enjoyed that. And thank you for all the things that you have done to support us, and we really appreciate you guys.
Well, we're very glad to do it.
Well, thank you. And that means you're the expert here to talk about home health agencies and some of these tips and questions. First of all, let's talk about some of the terminology used to describe the different types of agencies and what services they may or may not provide and how that factors into what they're called, and just kind of throw it all out there here.
That's a great place to start, actually. There's a huge difference between a home health agency and a home care agency. As you wouldn't go to a podiatrist to get glasses, you need to know what you're looking for. So if medical care is required, you'll select a home health care company. If non-medical care is appropriate, you would select a home care company. Under those headings, there are infinite possibilities. You have homemaker companions, you have respite care, you have personal care, and all of those categories open up yet more opportunities for services. The best thing that someone could ever do is to recognize the need. You have to be realistic about your need and go to the appropriate agency to start, or the appropriate type of agency, and then make choices from there.
So you said medical services or non-medical services. Tell us, like, what would some of the medical services that a home health agency could provide?
They could do therapies. There could be any kind of nursing services. Vital signs, taking blood pressure, blood sugars, those kinds of activities.
Okay. And then the non-medical, as you said, is more, explain like what is homemaker and some of these words that we hear all the time, but our viewers may not be as familiar with.
It's assistance with any activity of daily living that's non-medical. It can be as easy as, well, a companion service could be a trip to a doctor or to the grocery store. It could be assistance in the home, interaction with another human being. Mm-hmm. Homemaker services are what you and I do to keep our home clean and safe, and those are some of the activities that a caregiver could provide in home.
Okay. So obviously, since we're talking about really two separate groups of services, I'm sure the licensing and requirements are different as well. Could you expand upon that a little bit?
Very much so. If someone was looking for services, the best place to start would be the Agency for Healthcare Administration website. Very comprehensive list of different type of licensure. It's relatively self-explanatory. As you explore the agency and the list, you get a good idea of what type of services. It will pull up a group of agencies under the licensure. So, if you started there, you going down the list, you could have a homemaker companion agency. You could have a respiratory therapy agency. One agency could be licensed under many different categories. Once you've gone through the list and you've seen what's available, the next step is to talk to those agencies.
Okay. Well, like you say, really realizing your need is going to help you through this search process.
Very much so.
To determine what is the best fit. Well, what about typical requirements for bonding, licensure, insurance? How does that work when someone's coming into the home? A lot of people are a little concerned about that.
In the state of Florida, you should be licensed through the Agency for Healthcare Administration. You can trace an agency that's through that website, the ACA website on myflorida.com. Bonding and insurance is up to the discretion of the agency. It's a very important, in my opinion, protection for the client. You want a company that not just provides the services, but also protects the interest of the person needing the services, which are sometimes vulnerable people.
Mm-hmm. Does this also include background screening?
It can. That is a very important part of maintaining licensure and protecting, of course, from the agency's angle, your insurance and bonding. Background screenings are mandated through the state of Florida on a level of local and state, and many agencies, ours does, go for the federal background screening as well as an extra precautionary measure.
So you would put that on the list of questions that people should ask, is what is your
Always.
policy on background screening and licensing and all that?
Always.
What about questions somebody might want to ask pertaining to follow-up from the agency? How is the person doing? Or maybe if they don't particularly care, maybe they don't have a good match personality-wise with the person. What is the way they inquire about the procedure for monitoring the care and feedback to the family?
One of the most important things a family can do is be involved. You don't have to be next door to your loved one while they're receiving services or in the home to be involved. You can request monthly updates, you could request weekly updates. They can be over the phone, it can be an email exchange, it can be in written format left in the home for someone who might visit their loved one frequently. If I were the family member of someone requiring services, those are the kinds of things I'd like to know. If I couldn't physically be there, is my loved one eating well? How much? Or is she to the doctor on time, or is she neglecting anything that I need to be aware of? Communication can come in any form, and it's really the option of the family how they'd like to get that information.
They should set that up as an expectation with the agency.
Without a doubt.
What about supervision of the staff? I mean, I know you're probably not going out to homes, but I'm sure you're keeping up with your staff that do. How does that side of it work so that the family can feel secure that the people in the home are being monitored by their agency?
One of the best part of the day in an agency is getting to visit with your clients. Unexpected visits are a lovely way to make sure everything's going well and you have a good clear picture. It's also a great opportunity to monitor things. It's great to have a skill level of a certain caregiver in a home, but you also want to make sure there's a personal connection there. It requires a visit to the home. It requires phone conversations with the clients or with family members, whichever's appropriate.
Well, that's good information. Well, what are some other tips that you commonly tell people that may approach you? I know you probably get questions at the grocery store, for example.
Review needs. As frequently as necessary, review the need of the client. Stay in good contact with the service provider and review with the state of Florida through the Agency for Healthcare Administration the laws, the regulations.
Okay, and that phone number is 888-419-3456. So our people can give that a call. Again, that's 888-419-3456. And thank you very much for being here. We appreciate it.
Thanks
again for all y'all do.